Even though every month should be National Mental Health Awareness Month, technically the month of May has that honor. So let's get into it with a new innovation that could help a lot of people. Joining us live, Dr. Brandon Bensley, co-founder of Bay Area-based Magnus Medical. Good morning to you.
Good morning. Thank you so much for having me on the show today.
Yes, okay, so this is a little complicated for the average person, i.e. me, so I'm hoping to describe this in the simplest terms that we can. We're talking about people who are experiencing major depression, right? And that this trial that you are conducting could help them tremendously. So what is the treatment that you are offering?
Absolutely. I'm really excited to talk about it. For me, as a mental health advocate, as a physician, as a psychiatrist, this treatment's really a dream come true. For people suffering from depression, which is the major cause of disability worldwide, actually, most treatments don't work. Typically, we think of antidepressant medications, but they take weeks to months to even years for people to get better, if they get better. And about half of people never do. We call that treatment-resistant depression. And that's really hard for folks to be living with. And as a mental health provider, I got frustrated with that, and my colleagues did as well. So we have a treatment now where we actually map people's brains and then use what's called neuromodulation to treat the depression. So instead of taking weeks, months, or years, it takes 5 days. And instead of only half of people getting better, we have 80 to 90% of people getting better during that 5-day time period.
I'm seeing a device that is being used on this person's head. What is that device and what is it doing?
So that's a neurostimulator. It's non-invasive. And what it's doing is it's actually sending signals to the brain. We start out with brain mapping based on MRI, and then we use a special camera to get that stimulator in the right spot for that individual person so that we can treat their depression. And then the stimulator sends signals pretty similar to the signals your brain uses to create a new memory. And what that does is it pushes the brain from a depressed state to a non-depressed state.
And how long does that effect last?
Yeah, it's a really good question. Highly individual. For some folks, some of the first people we treated were, I think, maybe 4 or 5 years out now, and they're still well from the first treatment. Other folks may need additional treatments throughout the year to stay well from depression.
And is it possible that people would still be on some sort of medication and then use this as a supplement?
Absolutely. Yeah, at the end of the day, as a physician, I see my role and the role as the physician to have those personal conversations continuously with people to try to figure out what's the best combination treatments at any given time.
Now, you mentioned MRI, so that's the way this has to start because you're going to map the brain.
Absolutely.
Getting an MRI can sometimes be tricky because traditionally you need a physician's approval that goes through your insurance. The insurance only really offers the MRI as kind of the big last hurdle to discover what's going on with you. So, and MRIs are extremely expensive. So if it's not being covered by insurance, I could see that being an issue.
Absolutely. So with any new type of treatment, any type of new technology, it usually takes a while for the insurance companies to get on board and start paying for the treatments, which is always a hurdle, and actually especially a hurdle in mental health, one that we're working really hard on changing. The MRI is necessary, though, and the reason we're able to get these really amazing results is that we're looking at every individual's brain as different. Just like people have different behaviors and different personalities and different shapes and sizes, our brain networks are all different as well, and we really need that information. I would add, too, that other brain illnesses, like, for example, things like Alzheimer's disease, things like migraine headache, all of those are typically people receive MRIs and they're covered by insurance. Depression is the most disabling disease worldwide. To us as physicians, it really makes sense that would be something that becomes standard practice in the not too distant future.
I think you make a really good argument. We got to go. This is really fascinating. So for people who are interested in learning more about this, where do they find that, or even to get involved in the study?
Yes, it's a great question. So right now, we're setting up more clinical trial sites every day. And these are real world clinical trial sites, so everyone's going to be getting the active treatment. And because we're setting up new places every day, I recommend just sending us an email actually to info@magnusmed.com.